Hi Jacob, my name is Kevin. I'm a student physical therapist working under Dr. Clausen. So today we're going to be using NMES or neuromuscular electrical stimulation on Jacob here. He's about 2 weeks from an ACL reconstruction surgery right over here. So the reason we want to use NMES is to prevent atrophy since I don't believe he is cleared to do voluntary exercises on his knee right over here. So the reason we're doing this is to prevent atrophy. Since he can't actively, contract or use his muscles, he will lose some of that muscle mass, and we do not want that. All right. There are some contraindications for using NMES. Mainly, the main one we're worried about today is putting electrodes over the desensitized area. So, for example, he does have an ACL reconstruction. If you can see, there would be a scar right over here where there would be a desensitized area. Other contraindications, of course, exist, such as if he had a pacemaker or if he was female and he was pregnant, we wouldn't want to put electrodes around that area. But the main one today that we're worried about is the desensitized area. So, Jacob, how are you doing today?
Doing well.
Doing well? All right. So we're going to be putting some electrodes just right over here to facilitate, some muscle contraction. So you will feel your muscles start to contract. We're going to be just doing some 10-second on, 50-second off contractions. I'm not sure if you know what I'm talking about, but we'll cover it again when we set it up. But the main purpose of this is so that because we aren't able to walk on it or do any exercises, we do not want to lose any of that muscle strength or any of that nervous system input to those muscles. So that's the reason we're doing that today. If it's okay, I'm just going to be moving the shorts up so we can place the electrodes.
Yeah,
I'll just be placing one here and over here. We're just going to be avoiding that cervical side, okay?
Yeah.
Alright, so I'm going to be pulling the shorts up. Just right over here. Okay. And is it okay if I place the electrodes on?
Yep.
Perfect. So I'll be placing the electrode one right over here. So we have his surgical site. We do want to avoid that, but we're going to be placing it right along the rectus and the VMO, and then we're going to be placing another one right up here, and this will allow the electrical current to flow through here to allow that muscle contraction. Right. Another thing too is I'm going to be feeling the skin around the area just to make sure that he is not desensitized to the area. So can you feel this?
Mm-hmm. Yep.
Yeah, all over here?
Yep.
Okay, perfect. So, if you want to come over here, Eric. What we're going to be stimulating mainly is the alpha motor nerves. So, the parameters we're going to set, we're going to be doing a biphasic, 10 seconds off, 10 seconds on, 30 seconds off. We're going to do a 1 ramp up. Our rate or our frequency, we're going to bring it up to 80 pulses per second. Okay. And then our width, we're going to bring up to 400 microseconds right up here. Okay. And we can come back over here. What we're going to do is we're going to turn up the amplitude to as much as tolerated by the patient when we see that muscle contraction. All right, Jacob. So I want you to just let me know when you start to feel something over there, and then you let me know when you start to feel contraction as much as you can tolerate. We don't want it to get painful or anything.
Got it.
Okay. So we're going to be ramping it up. So what I'm doing is I'm looking here, and I'm looking at his quad to see it fire. How are you doing, Jacob?
Fine.
Good?
Yeah. Okay, we got tingles.
Tingles? So I'm going to keep going. Just let me know when it gets too much, okay?
Mm-hmm.
Okay, so I see some contraction now. You doing okay?
Yeah.
So I see it pulsing. So we're moving it up. You're doing okay?
Mm-hmm.
Keep going.
Yeah.
Let me know. Right there.
You can go a little more.
A little bit more. Yeah, so you can see the quadriceps firing right now.
All right.
Right there. Okay. So I'm gonna start it. We're just gonna be doing 2 reps. Okay. Today, so 10 seconds on, you're gonna feel it. So it's contracting right now. I really want you to push the back of your knee into the bed, and we're relaxing. Okay. So right now we have about 30 seconds off. We're gonna do it one more time. Okay. I'm gonna grab this pillow right over here. I'm just gonna be putting it under. Okay. So what I want you to do is the back of your knee. I want you to push into the bed when it starts to contract. Just really like squeeze that quad for me.
Question for you: how do you know where to place the electrodes? Is there like an optimal place?
Yes. So we are putting the electrodes over motor end plates, which are like where the nerves are most sensitized for like that muscle contraction. Okay. Squeeze that. Squeeze, squeeze, squeeze. Doing okay?
Yeah.
Yeah.
We're contracting.
All right. Perfect. So I'm gonna stop it right now. Okay. Doing okay?
Yeah.
And then I'm just gonna be checking the area of the skin after, so I'm just gonna be taking these off. And I'm just looking for any, redness or anything like that. Looks good to me. Doing okay?
Good.
Awesome.
That was excellent.
Thank you.